certainly someone who's been instrumental in having this Ottawa clinic up and running. And I would like to introduce nous. Et il va faire l'ouverture avec tous les autres gens de cette cérémonie pour la clinique. Merci beaucoup. Thank you for coming.
Thank you and welcome to all. Merci, Denis. This is truly a proud moment for OCAL. This day is what I will coin as a historic day for OCAL. Since our first clinic opened in Hamilton in 1989, you know, we celebrated our 25th anniversary last year. To be able to have today happen and have all of you, our distinguished guests, partners, and friends of OCAL here, to be with us today is extremely special. It's taken a lot of work to get here, but we're here. And today we're extremely pleased to have you join us. Not only our partners in prevention, our board of directors who are here present today, all of our staff from all of the clinics around the province have joined us to help make this day special. You'll meet some of them later when you go around to the different rooms, and you'll get to learn a little bit what each discipline does for OCAL. So I invite you to stay afterwards to do that, as well as you'll have an opportunity to sit with Minister Flynn and the CPO George Gritsiotis to have a little round table discussion where he'll entertain questions and have a bit of discussion with you. We're also pleased to invite and welcome all of our clients, our future clients, and everyone who was involved in preparing for today's celebration. This is an event that doesn't just happen, but to have it happen is because of you. So we thank you, and special thanks. Denis mentioned that there are many instrumental people in making this day happen. It wouldn't have been for the efforts of our previous executive directors or managing directors, namely Alec Farker, our past managing director / CEO, Anthony Pizzino, and more recently and currently, Michael Roche, along with our COO, Chief Operating Officer, Dave Wilkin, along with the board that has actually been championing this cause for many, many months to make this a reality and working with the ministry to get where we are today, to enable us to have the funding, to have the ability to provide the services of OCAL to all of our friends, partners, and OCAL family in the Eastern Ontario region. After 25 years, it is great to be able to announce today the opening of our 7th permanent OCAL clinic. It's now a reality. Finally, we're able to provide the services to meet the needs of our workers, for whom we serve. We can't forget, our workers are who we are about, who we're here to serve, and what we are all here to represent. From all corners of the province, we also have had this void in Eastern Ontario for 25 years, and we're now able to close that gap and fill that gap. We're also very pleased to have many of the people who are going to become close partners with us, namely the Ottawa District Labour Council, along with Sean McKenney, who's the president of that Labour Council. I'm pleased to have you here. The council will be very integral in the establishment of what's called the local advisory committee to this clinic, so that the different partners, whether it's employers, whether it's workers, whether it's unions, whoever it may be, will be the body that will be put together that will help, as you know, Denis Boileau, the executive director, work with the clinic to say, here's what we need, here's where the voids are, here's the services that we require, and we will listen to them, and we will grow, and we will expand, and we will meet your needs. I give that solemn promise to you. And again, as far as the final welcome to our distinguished guests, we have not only Minister Flynn, who I'll introduce shortly, but who's the Minister of Labour, which we're very pleased to have with us today. We have the Chief Prevention Officer, George Gritsiotis. And without those two gentlemen's dedication to OCAL, this day would not exist. So without further ado, I'd like to introduce you to Minister Kevin Flynn.
Thank you, bonjour, and thank you for having me here today. It is a pleasure to be here. So many faces, so many people I've met this morning I already know from different areas of the province and different endeavors, and even in different jurisdictions. So I know how much an opening like this means. I know that those people that get what health and safety is all about, those who understand occupational illness, those that understand occupational injuries will understand what this means to the province of Ontario. And that's why I think we have such a packed room, and I hope you're not too hot out there. I'm glad to be joined today by who I think, I'm pretty sure I can say this with some confidence, that Ontario is the only, or if not the only, one of the very, very few jurisdictions in the entire world that has a chief prevention officer, that has an officer that's assigned specifically to the prevention of workplace injuries. And I'm really proud to be joined by George today. He's been doing some great work helping to enhance the health and the safety of all those in our province. But I want to thank each and every one of you for taking time out of your busy schedules to be here today. And as I said earlier, it's because you understand the magnitude of what's being announced here today. It's not very often in government where you can do one opening and you increase the opportunities, you increase the capacity that you have within any system by 20%. That's exactly what we're doing here today. By doing one opening, people in this province are going to receive services increased, are going to see increased services in the number of 20% just by the turning of the key or the cutting of the ribbon today. So it really is great news for Eastern Ontario, great news for Ottawa. Now we're working hard as a government to build Ontario up. We're investing in our schools, in our hospitals. We want to create those jobs around the province that we know that you and the people that you represent need. We want to also ensure that Ontario remains one of the most attractive places for people to invest, but also to live, to work safely, to raise a family, and come home to that family at the end of the day. We are one of the safest jurisdictions in the world, and we can take some satisfaction in that, but I don't think we should be entirely satisfied with that. We should be proud of what we've been able to do. In the past decade, we've been able to reduce workplace incidents by about 40%. That's significant. Since 2003, workplace incidents have come down somewhere in the 40s. And as I said, we should take some pride in that. We should celebrate that. But we should by no means be satisfied with that. Because I think we all know, people in this room especially, understand the implications of what happens when there is an occupational injury. What happens? What's the impact of occupational disease on a family, or on the individual, on the people around, the loved ones around that individual as well. Everybody suffers, the community suffers when we have a workplace injury. The recovery after the injury, though, is important, and the services that you provide, the counseling you provide, the access to the ability to return to work is second to none, and that's why we make occupational health and safety such a high priority, and that's why we see you as such a valued partner. So that makes the pleasure of being here today to announce the opening of a brand new occupational health clinic for Ontario workers right here in Ottawa such a satisfying announcement to make, because you know that those immediate implications are going to be felt within families very, very quickly right in this hearing. There's a sense that if we keep doing the same thing, we're going to start to get the same results. Doing the same thing over and over again. So if you're satisfied with where we are today, I'm not. But if you are satisfied with that, we just keep doing what we're doing. But I want people that don't understand what's going to happen in this building to be aware of what does happen in this building and why we start to take the innovative approaches to lead to those improvements that we really want. For people that are unfamiliar with the occupational health clinics for Ontario workers, or OCOW, I left my cow in the other room because I figured it wouldn't stand here, but I do have a cow that I'll be taking back to Toronto with me. Thank you for that. But they're a very hard-working organization, and they're a health and safety association, of course, for those of you that don't know. And they're a valuable partner to the Ministry of Labour, which I represent as your Minister of Labour. They provide workers who have work-related health conditions with medical diagnoses, preventative information, and the services that those individuals need to come to recovery. We're proud that the Ministry of Labour is able to fund this new OCOW clinic on an ongoing basis, and certainly it's not a hard decision to make. I think they refer to it as a no-brainer. When you can get this much value for that much money, you take that opportunity, you make that investment. Certainly we didn't have to think long and hard about this one. You've got such an excellent reputation, you bring so much credibility to the table that it makes it very, very easy for a politician like myself and other politicians at Queen's Park that perhaps aren't as closely associated with the Ministry of Labor as I am. It makes it a very easy decision. And because we know that this new clinic is going to contribute to the health and safety of workers right across Eastern Ontario. It's going to provide clinical services that specialize in work-related injuries and illnesses, including those ones that we know develop over time. Over the years, the statistics that have built that credibility are impressive. The multidisciplinary occupational health teams in OCAL clinics so far have worked on more than 31,000 patient cases, 11,500 workplace interventions. They've developed more than 500 occupational health-based prevention tools and resources. You presented almost 11,000 education sessions, and you've responded to this, an incredible number. You've responded to over 100,000 work-related inquiries. So often we don't sit down and take a look at what we've accomplished or what you've accomplished as an organization. They're pretty impressive numbers. So the actions all contribute to the reduction of fatalities in the workplace, injuries, illness, or disease in the workplace. In short, OCAL clinics have unique knowledge and expertise that can assist in finding solutions that save lives in this province. Thankfully, as of today, these services are now readily available in Eastern Ontario the way they are in other areas. The full-service clinic, through its clinical diagnostic and prevention services, will assist vulnerable workers, including those from Aboriginal communities, small businesses, workers in high-hazard sectors, including construction, mining, agriculture, as well as workers diagnosed with occupational disease. Regionally speaking, this clinic doesn't only provide services to Ottawa, it's going to efficiently provide OCAL services to communities right throughout Eastern Ontario, including Ottawa, but also including Kingston and also including Cornwall. So we're very, very proud. The ministry, myself, are very proud to provide OCAL with the funding to get this clinic off the ground, and we want to keep it running on an ongoing basis. We know the value it provides. I've been incredibly impressed as well, I still feel like a new Minister of Labor, but apparently I've out-averaged the average stay for people as Minister of Labor, so I feel like I'm becoming an old guy already. But certainly it's a job that I really, really enjoy, and it's a job I'd like to keep doing. But I'll tell you, there's a rotten side to the job, and you all know what that is. It's when that email comes in, it's when that phone call comes in. It casts a pall over our office, because you realize that somebody's not going home that day, that somebody that left the same way that you or I left for work this morning simply has gone to a hospital and hasn't made it, or funeral services are being arranged as the phone call is being made. We don't want to see that anymore. And it's organizations like yourself that I think impress upon everybody else in this province the importance of that. I know you're going to provide your community with excellent service in the years to come. And this only works because we work together on this. I think when you get business, labor, and government talking or singing from the same songbook, you get things done. You get days like today. There's very few days, you might think I run around the province cutting ribbons. There's very few days that you get to do things like this. These are the days that linger in your memory, that you really feel like you've done something good, that you've made a difference, that because of what you've done, things are going to change a little bit, and things are going to change for the better. So I'd like to thank you once and all again for coming out here today. I know there's members of council here, city council here today. I met Mark Taylor earlier, and I think Mark is somewhere around here. No, Mark, thank you for coming as well, and our best to Jim Watson. I know John Fraser is feverishly trying to get here to join us today, and don't be surprised if you see him at some point during the morning. But before we get to any more questions, what I'd like to do, or any questions at all, what I'd like to do is introduce you to the man that I talked about at the very start, the man I think is the only Chief Prevention Officer in the world, and that's George Graziotis. So George, if you'd like to come forward, congratulations to you all.
I need to validate that. So there's a lot of people here, I know, a lot of friendly people, and I'm going to point a few people out. But Sylvia reminded me, Ottawa's my hometown, and I've been in this job for 5 years. And as Chief Prevention Officer for Ontario, this is probably one of the first formal announcements I'm making in my own hometown in Eastern Ontario. This is a sort of a doubly important and gratifying for myself as well. So, and I'm hoping that we can continue to make these kinds of announcements as we go forward. You know, as the minister said, there's a lot of important people, and David also pointed out, there's a lot of important people that have been working shoulder to shoulder on this and really coalescing together and pushing it forward, right from the minister's office, David's office. But there's some folks in this room that I like to say are you know, part of the founding members of OCAL that I like to point out, which is a John Perquin. John, I'm not trying to put you on the spot, but you know, you've got enough corporate memory to probably give everybody, we could spend the day here with you and get a historical account on how OCAL even came about. So all of you have you know, played a role in you know, having conversations with me and the importance of the work of OCAL. And some of you may or may not be aware, but I have oversight of 6 health and safety associations, of which OCAL is one of them. OCAL, I like to say, I like to distinguish it in that it provides medical, clinical services, an important service to the province. But one thing that, you know, and I'm a data guy and I like to look at what the needs are out there. We've been exposed to toxic substances in the workplace. Occupational disease accounts for 2/3 of all fatalities in our province. So, you know, we have anywhere, depending on what the year is, because we cycle up and down, we lose anywhere between 250 to 300 people to fatalities as a result of traumatic and occupational disease. But just looking at the OC disease side, you know, that is an area that we're even aware of, that we understand, because there are many people who retire, move on, and we may not even attribute it back to what's happened in the workplace. So there's so much more work that needs to be done, and I look at what OCAL is doing as being really sort of groundbreaking watershed work. The one thing that, you know, in my conversations on why Eastern Ontario, when we look at OC disease, 20% of those fatalities take place or are attributed back to Eastern Ontario. So, you know, as the minister said, it didn't take much to really figure out that we need that capability here in Eastern Ontario. And quite frankly, if I can find ways of building on it and leverage partners, both through the province, through the city as well, if there's ways we can work together, let's do it. Because I think that, you know, there's a lot of institutional touch points that all levels of government have in the workplace. I think we need to work hard to make sure that we can provide the best service possible. For the past 26 years, and you know, I'm actually going to be communicating this to many people who are already aware, OCAL has been leading the way through innovation and providing what I consider to be some of the highest level of clinical and occupational health and prevention services to vulnerable workers. And when we think of vulnerable workers, always remind yourself that, you know, our workforce is changing. New Canadians, non-standard work, there's a lot of different things happening out there and we need to keep pace. So an organization like OCAL, I believe, is on the leading edge of being able to deal with those kinds of things. And OCAL, I believe, provides some of the most significant services across all of the health and safety associations, not trying to minimize the work of other health and safety associations, but the uniqueness of it as well. And the other thing I'd like to commend OCAL is its ability to partner across all of the health and safety associations as well. You know, some of you may or may not be aware, but OCAL is a leader in utilizing technology through application, you know, that they've made available through our, you know, our phones. I mean, I don't know if you'll be talking about that today, David, but you know, they're a leader in that area and have actually shared that technology with other health and safety associations, not only to deal with current issues, but to also deal with some of the new and emerging issues like mental health and like PTSD and you know, traumatic mental stress. The cost of occupational disease to our healthcare system and our economy is substantial, and as the minister said, you know, that pales in comparison to the impact it has on individuals and families. So, you know, for me today, you know, this is not just about the service, but as the minister said, it's what we do for our community as well. So today's opening in Eastern Ontario, by the way, provides OCAL now 7 fully staffed clinics. So now you have, and David had to make me memorize this, but I have to write it down, David. I'm 56 and I can't remember anything. But you've got a clinic in Toronto, Hamilton, Sarnia, Windsor, Sudbury, Thunder Bay, and now Ottawa. The other thing I'd like to point out is a part of my role and my legislative responsibility to the minister is I had to develop back in 2014 the province's first occupational health and safety strategy. There's some key priorities there around supports for small businesses, high hazard, and there's one on vulnerable workers. And OCAL has always been a key deliverer in helping me implement that province-wide strategy. And I look forward to continuing to work with both David, Michael, and the board to deliver on those priorities. So, needless to say, we, the minister, the Ministry of Labor, and the system partners across all systems are proud to say that we'll be providing $777,000 in operating funding for the new clinic, and we'll be doing it on an ongoing basis. So, John, you gave me a challenge. You gave me a challenge.
Said $1 million. You came close.
You gave me a challenge, and you're trading another challenge. So just a little information, and I'm sure David will be sharing some of this with you. But the clinic will have their staff will include a client service coordinator, an ergonomist, occupational health nurse, a hygienist, and also a occupational health physician on contract services. And I know that you're also hiring bilingual staff for the clinic as well. We did a business case as we rolled this out, and we're expecting the clinic will have the capacity to handle anywhere between 125 and 150 cases every year, and as well as at least 100 inquiries and more than 40 prevention interventions and over 25 educational sessions. That's the demand we're aware of, and quite frankly, those are numbers that can change, but we know the demand is here, and we're here to help boost OCAL's capacity by 20% today and whatever we need to do going forward. So I just also wanted to let you know the conundrum that Eastern Ontario was in prior to today's opening, that a patient in Eastern Ontario had to travel to Toronto or Sudbury or another clinic for a consultation. And I think that when anybody's going through a disease or any kind of tragedy, the last thing you need to do is put that added stress. So, for me, this is about, as the minister said, ensuring, it's about the family, the community, and the people, and being able to deliver locally. So, we've eliminated that barrier by opening the clinic today. So I just, with that, I just want to extend again my congratulations to the staff and look forward to continuing to work with OCAL, and have already actually put in a little bug in David's ear that since I work out of Ottawa Mondays and Fridays, maybe you guys could give me a landing pad here every once in a while. Sure. Okay. Thank you. Thank you.
So Monday and Friday, and I'm Tuesday, Wednesday, Thursday.
That's good. We'll work on that. So thank you very much, everybody.
Thank you very much, David, and I won't take but a moment, but certainly as not just community stewards, but as a large employer in Ottawa, the City of Ottawa recognizes the great work that OCAL does, and this is certainly a wonderful opportunity to expand your footprint here and help so many more people in our community. So on behalf of Mayor Watson and my council colleagues, Councillor Leeper, I'd like to present this to your board chair, or to you, who are the board chair. Perhaps I could ask the Minister and MPP Fraser to join us up here. Yeah, we'll do it out here.
Yeah,
sure. There we go. There we go. There. Jeff, you in there?
thank you.
Just very quickly, it's really a pleasure to be here today, and I'm sorry that I'm late. I want to say two very quick things. Is that I want to thank everybody who works here trying to improve the lives of people with injury. It's really very important to work. You get people back on their feet, get families back together again, and I'm sure that you see the fruits of your labor. I just wanted to thank you for that. I wanted to thank the Minister for being here today to open, to cut the ribbon. And I'd like to say a couple things very quickly about the Minister. I know that he's very committed to his ministry and to the people who he serves. Spent some time together yesterday talking about issues related to things like post-traumatic stress with different people. And it's very clear in those discussions and conversations that we have, and we have at Queen's Park, that he's very committed to that. And it's a pleasure to be with him here today. Thank you very much.
That's a check, is that your sign?
You got your million, John.
Don't worry, the carbon's underneath. There we go, and we'll get everyone else to sign. So right now I'll ask the minister to come forward, and I'm going to safely and don't run with the scissors. One on the other side? I think that might,
Cutting fabric.
So if anyone with the cameras want to come forward to take the picture of the video, that would be great.
No.
So
Okay,